Welcome to What is a Medical Home presented by Indiana Family to Family. Indiana Family to Family is the parent-to-parent organization and family-to-family health information center for Indiana. These centers are statewide, family-led organizations that assist families of children and youth with diverse health and mental health needs and the professionals who serve them. We provide information, education, training, support, and outreach. The information in this video is current as of August 2025. As with any resources or information, it is important to verify the information provided to ensure it meets the same needs as your situation. You may have heard the term medical home and wondered what it means. You might even envision a child with multiple medical needs living at home with specialized equipment, medications, and treatments. However, a medical home is an approach to providing comprehensive, high-quality primary care. A medical home is not a building or a place. It is a partnership that involves you, your child's doctor, clinical specialists, community resources, and others, all working together to support both excellent health care and family satisfaction. So a visit to a doctor's office that uses a medical home model would look something like this. The office staff warmly greets you as you sign in. A short while later, a kind nurse checks your child's blood pressure and carefully reviews health history. When the doctor enters, you engage in a genuine conversation on the latest developments in your child's health, and together you develop a working plan to address current medical needs and overall health. To ensure that all children receive high-quality medical care, the American Academy of Pediatrics and the National Center for Medical Home Implementation list several essential components of the medical home model. A medical home should be accessible, family-centered, continuous, comprehensive, coordinated, compassionate, and culturally effective. Let's talk more about each of these key components. So what does it mean for care to be accessible? It means that care is provided in your community, that the doctor's office accepts your insurance, that the location meets the Americans with Disabilities Act or the ADA requirements, and there's access to health advice or care that is available at any time, 24 hours a day, 365 days per year. For care to be family-centered, the office staff must recognize that you and your family are the principal caregivers in the center of strength and support for your child. It also means you and your doctor share the responsibility in all decision making. So what does it mean for care to be continuous? It means that the same doctors are available from infancy through adolescence. It also means that communication occurs between doctors and specialists to ensure your child's needs are met at any age. It also means that assistance is provided to secure a medical home for adolescents transitioning into adult care. For care to be comprehensive, it means that preventative and primary care is provided. It also means that growth and development assessments are conducted when appropriate, that care coordination is practiced amongst all of your child's doctors, that referrals to specialty care services are provided when needed, that child and family counseling and health education are available, and that your doctor is knowledgeable about community resources and shares that information when necessary. What does it mean for care to be coordinated? It means you and your family are connected to appropriate support, education, and community services. It means the office staff communicates and works with all agencies to ensure that all your child's needs are met, and it means that you, your doctor, and the office staff maintain the centralized record containing important information on your child's care. What does it mean for care to be compassionate? It means that the doctor shows concern for the well-being of your child and your family as a whole. It means that the doctor is sensitive to the wide range of emotions that families may experience when the child has additional healthcare needs. It means that the office staff is flexible and responds to requests and needs. And it means that appointment times are scheduled with consideration for your family's needs. To be culturally effective, it means that your family's cultural background is recognized, valued, and respected. It means that the office staff is sensitive to stereotypes and cultural assumptions, And that also means that materials are provided in the language that you can read and understand, and translation services are made available when needed. Additional information on this topic as well as others can be found on the Indiana Family to Family website. For one-on-one support, you can complete the form found on our Connect page of our website, call 844-323-4636, or email info@inf2f.org.